السلام عليكم.
السلام عليكم دكتور، كيف حالك؟
أهلين، الله يعطيكم العافية.
يعطيك العافية دكتور. Good afternoon everyone. I'm Natim Bakari, the co-founder of the Saudi Neurology Interest Club, and I'll be moderating today's session, inshallah. We're truly honored to have Dr. Ahmad Laban with us, an associate professor of neurology at King Saud bin Abdulaziz University for Health Sciences and consultant neurologist at King Abdulaziz Medical City National Guard Hospital. Dr. Ahmed is a distinguished clinician researcher and man whose advancing neuroscience and supporting young researchers have made a remarkable impact. For today's session, I'll publish a Google invaluable site for anyone interested in contributing to the field through research and publication. Thank you so much. The floor is yours, Dr. Ahmed.
Do you see the slides?
Yes.
بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله. And I think I will just be brief and get to the point, try to make more room for questions and answer. Okay, so when we talk about publication in neurology, or when you ask the question how to publish in neurology, it's actually the last step of your research. Doing research without a publication, as if you've done nothing. Doesn't mean that you don't do research. We learned a lot. I wish if I knew this from early on. If you do any research, try to do it in the correct way, and then you take it from A to Z. You always have to learn from the mistakes of others, and as I'm going to show you is one of the important things is just you need really a good mentor to help you and guide you how to go and navigate your way. Why publishing in neurology? It's really important. People do research and for various reasons. And it is totally okay. Some people will do research for promotion. Some people will do it to get credit, to get the job, to be accepted in the residency program, to be promoted from assistant professor to associate professor, to be promoted from associate professor to a full professor. As long as we all add to it that we want to advance science and we want to advance knowledge, and we do it with honesty and being transparent, that's really the most important. We have to avoid the misconduct, the fraud. That's all very important when you take consideration when doing research. One of the very important concept in doing research, and one of the fastest way to do a high impact research is to connect with a mentor. I cannot stress more on the importance of the mentor. It's really very important. The mentor will help you to go directly to he will bring the research gap to you, and he will tell you what is doable, what is not doable. He will tell you, he will teach you how to ask an answerable research question, and he will even help you through the steps. He will tell you, the mentor will also preferably from the same institution. That will even be much better, because he knows the system, he knows the how to get things done. When you do research, there are many obstacles. People do different kind of research, starting from case report, which is very simple. You need a mentor in all kind of research. Until you become a mentor, it will take time, but you need to learn step by step. One of the misconception, please mute your mic. The big misconception is everyone. Can you please mute all the mics? One of the big misconception is that
دكتور ما نقدر نسمعك لأن في واحد سوى ميوت أول وما عاد نسمعك.
طيب تسمعوني الآن؟
Yes.
اي نعم نسمعك.
شكل الصوت يمكن كان عندي من هنا، أنا كنت أحسب إنه من عندكم من الشاشة. عموما الآن السلايدز، تشوفوا سلايدز؟
نعم.
طيب. Very big misconception among the students and residents. You have to learn everything about research. No, learn only about the research you're doing. Even before you do it, you have to ask, is this simple? Can I do it? What do I need to learn? Learn everything in your project. Only learn how to do the plan, get involved in all the steps. Don't just there are people who do research but just asking, please put my name. Please don't be one of those guys. It's really very bad. Not every, you remember this slide, I showed you this slide. Many people do research for many reasons. That's okay. But please, when you do research, do it the right way. You are not necessarily a researcher. Not everyone will be a researcher. I mean, we love researcher. We want most of you to be a researcher, but it's a fact. Not every physician, not every clinician is a researcher. There are people who need to do research as part of mandatory of to fulfill something. Do it the right way, in a simple way. Learn first, is this research project fulfill your objective? Can I do it the easy way? Is it seconds? How much time do I have for this research project? What is my timeline? What is the effort I'm gonna put? What are the resources I'm gonna need? There are researchers who need grants, so it's not applicable. Sometimes students will have an excellent research idea, but they select wrong design. Or sometimes they put an excellent design, but not to answer the same question. So there are many aspects, and the easiest way is to learn by connecting to a mentor and making sure that you learn only about the topic that you're gonna do. When you learn about the topic you're gonna do, you need to learn two parts. One part related to the research questions, like scientific knowledge, and one part related to research methodology. So that's you're gonna learn from your mentor. And the most important, and I consider it the most difficult step, is to find the research question that is unique, that is of value to the literature, and will add an impact to the current knowledge. Research questionnaire, still can be of a great help in certain aspect if it's done for the first time, or it's exploring something unique that has never been done. So it can be of a huge impact. Everyone is doing like knowledge and attitude, or physical stress among medical students. These are overused titles. Don't just do research for just scoring the point. You're gonna do research anyway. You want to do research. Okay, do it the right way. And before you start, a good mentor will sit with you and ask you how much time you have, what is your goal, how long you want to publish this research, and he will guide you through the steps. So all these are very crucial before you commit yourself to something that you don't know for how long it will take, what you need to do. So there are many steps, and it's very important to collaborate. It is the research is not one-man show. All the good works need collaboration. So involve colleagues, make sure that you are working in harmony, and you agree about all the steps. Authorships also need to be decided early on. Who's the leader? What is the role of each one? Will decrease the disagreement later on. When you select the journal, you have to read the objective of the journal. I'm going to talk about the manuscript, how to write the manuscript, certain advice for each part. It's very important. You can sometimes do an excellent research, but you send it for the wrong journal. It will be rejected. So choosing the journal is really very important. You have to select the journal that is suitable for your research. How can I know what is suitable for my research? First, and always like ask your mentor, check the journal, read the journal goal and scope. Is the journal accepting, for example, case report? Is the journal accepting local data? Is the journal accepting basic science research? So if you don't read the journal objective, you will be just wasting your time, waiting for the reply of the journal 3 months while it is outside the scope of the journal. Sometimes the journal can get up to 4 months to just to reply to you. So you wasted your time. And it is unethical to submit for multiple journals at the same time. And some people like even mistakes happen, and some people get the same papers accepted in two journals. And if that happen, you will be blacklisted. So you have to assess the scope of the journal, what is their publications, and all the journals are classified into Q1, 2, or 3, or 4, and this is through the Thomson. You go there and you check. The more novel is the research, the more likely it will go to Q1. For you as a student or as a resident, at least make sure to publish in ICI index journal. That is really, or PubMed journal at least. Always be careful about the predatory journal. So do you know what's predatory journal? Anyone can tell? من الاتندنس anyone can tell me what's predatory journal؟ مكتوبة قدامكم هنا. موجود الناس ولا نايمين؟ What is the predatory journals؟ Guys, am I talking to myself or there is someone listening? Just say
We're
anything.
listening, but I don't
Or
think
they're muted.
no, we're listening, but
No, we're
I don't know.
listening.
Yeah, but we don't know the term.
Okay, so اللي هي الجورنالز المتوحشة أو اللي تخدع الناس، يعني هذول journals usually they ask for ما تيجي عليه advertisement في الإيميل submit your work and we will publish your paper and it's a fake journal and they take money from you. Believe it or not, usually in the almost every year I have when medical students apply for the residency program, والله العظيم, I'm not joking, أقسم بآيات الله, every year 3 or 4 students they put in their CV some publication about journal with name that is I'm not familiar with, and when I put the research in Google and I find the Google will give me only one research result, and you click and it's just a PDF file thrown in a website. So they just stole the money of the student. واللي يقهرني انه الستودنت مثلا ما يعرف ايش يعني بريتش جورنال، يعني هذه فيك جورنال، it's not indexed، ما لها اي registration. They just take your money and take the PDF file and put it in the internet. Okay, so now you know what's British journal. Make sure when you publish, at least your journal is in PubMed index at least. Okay. There are some journals with open access. Usually they require fee for publication. Most university hospitals and institution, they will pay you back the money. But you have to put the affiliation correctly. That is really very important. Now, doing publication in basic research, that usually you need to connect and work with someone in the lab. And that's usually if you have free time from clinical duty or during the summer training, you can do some clinical work. Now, when you write your manuscript, you have to concise theory and write concise, and you write to the point and don't avoid jargon or telling too much information. And you have to read in every journal there is something called information for author. You need to read it, you need to review it, and make sure you stick to it. If they say usually they put word limits, so you have to follow the word limit. We have the introduction. The introduction you have to give like 1 page to 2 page. What is done in the field, what is your research questions, what is already known, and the last paragraph should be your research question. Okay. Methodology should be transparent, clear, honest, and everything you've done. Usually, as in the one you did in the IRB. So before you start the research, you have to submit an institutional review board approval. So usually you just copy paste the methodology, so you use the same. How can we know the method is good? We can know the method is good if you just give this methods to someone else, and he will conduct the same study without the need to ask you any question. If he needs to ask you any question, that means there is something in the method. So the method should be clear, comprehensive, without too much description. Just describe exactly what you've done. When you write the results should be exactly as what you find it. You don't add any interpretation or explanation. Like the majority of our cohort was female. طبعا there must be a reason. Well, we did the study in the visitor in the woman hospital. You don't need to justify in the result. All the justification should go into the discussion. So in the result, you present the numbers and the findings as it is. The discussion part the first paragraph should contain the main finding of your study, the most important finding. And then you discuss all the other findings, the important one, and is it with or against the literature. And you put reference for all what you say from the literature as compared to your work. Then the last paragraph, or the one before the last paragraph, you have to put the limitation. Okay, and when we say limitations, you have to criticize your work, and you put everything negative about your paper. Don't wait for others to critique your paper. Critique your paper by yourself. So being an honest is the most important step as a being scientist and publishing. Okay, so you have to be honest and put all the criticism. If there is any deficiency, if there is any mistake, but I mean, you have to put it in a politically correct way, and with the great help of your mentor. Also in the methodology, by the way, if you used AI, you have to disclose that. Okay, it's very important. Nowadays, it is really, I mean, it's really, in my opinion, it is unacceptable to do a research without help of AI at all level. At all level. So I should use AI extensively at all level. And the last paragraph is your main conclusion of the study. Usually after you finish the manuscript, then you write the abstract. Okay, sometimes you have the abstract ready because the deadline of conferences usually push you to finish the work. That's okay, you can do the abstract, but usually if you just relax, the abstract should be the last thing you write, because after you write and draft everything, then you have idea how to write the abstract. Now, when you write, one of the big mistakes, and when people write, and طبعا the first manuscript I wrote, it took me 40 days. That is really huge, and it's wrong. You shouldn't do that. So when you write, you should not think about grammar. You should not think about, like, sometimes you're writing and in the middle of the writing you said, oh, I already said this. No, don't think. Just write. Just write. خلاص. The first thing the best thing to write is the methodology, the first methodology and the result. Methods, you get it from your RB. Result is just what did you find as it is. Introduction also you can take it from your the IRB proposal. The discussion, you need to take your time and just put the main items that you're going to discuss and then write down spontaneously. Don't think. The problem with many people is think they want to write perfect from the first time. I can tell you after experience, your first manuscript and first draft will not be perfect. So just don't care about perfections in the first time. Just write something. Just get it out. Write all what you want to write. It is repeated, duplicate, it's written the same thing in a different way. Just write it, put it down. After you finish, then you read it again and again and again. Any mistakes in the paper, it's really indicate that this is really poor work. Respect the word limit as defined by the journal. And as I said, there are many things. If you write, if you don't follow the journal recommendation about number of references, number of the word limit, this is usually result in auto rejections. Um, After you said, after you write the manuscript, then you write the abstract or modify the abstract if you already submitted to a conference. It's very advisable to submit your research to conferences because this will push you to finish before a specified deadline. The title of the manuscript should be the last thing to write because you really need a representative title. Now, there are two types of titles. There are titles like a description, like for example, the for example, let's take attitude of so and so about this. Where are some titles they exactly say the main finding of the study. Like for example, increased level of, for example, gamma interferon gamma in the CSF of MS patient, for example, as compared to other just informative title where you say finding of CSF, and which one will be catchy? If you say the main findings in the title, so the people when they read the title, it should be they have an idea about the what's in the research. If you have if you assume that 100 people will read your manuscript and research publication, so there are almost more than thousands read your abstract. And if there are 10,000 read your abstract, maybe million of people will read your title. Your title is the opening of your work. Your title is what comes in PubMed. Your title is what comes in search. And why you want your title to be catchy, why you want your title to be so unique is and to be you want a title that really representative of what's the content in the paper and something catchy because it's very important. عشان الناس تسوي لك يقول لك اعمل لي لايك وسبسكرايب وشير. You hear these things in the YouTube or social media. What really tells about the strength of the publication is the number of citation. How many people used your research as a reference? Okay, I have papers that are referenced more than 170 times. There are paper referenced 10 times, 15 times. So your strength as a researcher will be counted by something called an H index. And anyone can tell me what is the H index?
السلام عليكم.
سلام.
أيوة دكتورة، ال H index نستخدمه عشان نشوف الإمباكت حقت researchers publications. يعني مثلا عندنا 1 2 3 4 على حسب ال citations للresearchers.
Excellent. ترى هي there is no equation for it. It's very easy. The H index, for example, if someone has an H index of 4, it means that he has at least four paper published with 4 citation. خلاص ممكن واحد يكون عنده 15 publication وواحد عنده 6 publication، يكون الستة الاتش اندكس حقه اعلى من اللي 15. ال 15 ممكن الاندكس حقه يكون 1 او حتى ممكن يكون 0، يعني no one used him as a reference. بينما اللي عنده 6 publication it is referenced at least 6 times or more، فيكون الاتش اندكس حقه 6. خلاص يعني if someone الاتش اندكس حقه 15 it means he has at least 15 paper، every paper at least 15 papers cited more than 15 times. So the more you go, the higher the number. It's usually very difficult. It's very difficult. طيب. So that's one of the way to tell the strength of the researcher. طبعا the other important things you need to know is something called the impact factor. What is the impact factor? The impact factors, it's a measure, it is a number, it will tell you, there is a calculation for it. It is, it can tell you the strength of the journal. Okay? So usually everyone want to submit a research in high impact journal. Okay? I talked about the introduction, talked about the method, discussion, how you write everything. So all these, we talked about it. When it's very important to acknowledge, and anyone contributed to the research, you have to make sure that he's is either acknowledged or either an author. So one of two. And what are the criteria of authorship? So these are some of the journals that you can choose. Locally, we have the neurosciences. It's very well respected, and it's like the strongest journal in the region. What are the criteria of authorship? So طبعا بعض الستودنت many students they don't understand what's the criteria of authorship. They think they collected the data that is he should be an author, or he يعني مثلا facilitated the study, or he collected the questionnaire, or he designed, or he did the analysis. That is not enough. So the authorship, you mean at least you contributed to the scientific content of the work. So you contributed to it. So you reviewed the manuscript, and you participated into the theoretical content. Is very important. Avoid plagiarism. There are many softwares now for detections, even for AI. You have to have data transparency. Now some journals even require that you publish your you submit your raw data file. Always you have to check about language and style. You have to have proofread. Nowadays everyone is using just AI. In the past, people used to pay for these services. So the final really tips of publications: you have to select a mentor, you have to decide about the timeline, what is your objective of the research, why you want to do it. There are some guidance in the literature and checklist for checking the integrity of the research. Some are for retrospective or observational study, some for systematic review like Prisma. Okay, thank you very much.
يعطيك العافية دكتور. Thank you so much for such a
Happy
great
to take any
session.
question.
We'll now open the floor for Q&A. If you have any questions, please feel free to raise your hand or type in the chat box. And thank you so much for everyone who joined us today. Okay, Ragad, can you please unmute yourself?
يعطيك العافية أول شيء دكتور. It was very informative and very helpful. My first question is, sometimes we do not have a very good grammar, or even if we try to put our grammar better, there's not much time to edit and stuff like that. So sometimes we use applications or AI to make our grammar better, generally speaking. Do we have to include that we used AI in order to make our grammar better, or is it irrelevant?
So some journal. So that's, you remember when I asked you before you write manuscript, before you write your manuscript, you should select the journal. So because this will make your life easy. So when after you select the journal, you go into something called information for author. Read it quickly. What is their limit? What do they require? And some journals require complete disclosure for any AI use, even it's for grammar. And some journal would say, no, it is not required, only if you use it in drafting or polishing the manuscript. So it is different from journal to journal. But the key really is to be transparent about this.
Regardless of the journal, if it's
it's better
ambiguous.
always to disclose this. It's very better. It's better to disclose it.
Okay, thank you, doctor.
Welcome.
Asil?
Thank you, doctor, for this lecture. I have two questions. First one, if our study showed association, not causation, may I add this or mention this in the title, the result of the association?
طبعا خلينا نقول لكم يعني قصة صغيرة، وأنا أقول لكم كيف الميديا شغالة. التايتل ممكن يكون كاتشي، بس إنه يكون ترو. خلاص. مرة واحد قال لي نبي نكتب مقالة عن العلاقة، كان في رمضان، فعلاقة التصلب بالعصب المتعدد أو relation between MS and fasting. while he was asking me and I'm answering the questions, I said there is nothing specific، يعني there is nothing new. He said no. قال لي لا تقول لا يا دكتور كذا. قال لي إذا ما في شيء جديد ترى هذا الناس ما تقرأ المقالة. قال لي لازم يكون كذا شيء، يعني تعرف انت بعض الاحيان زي الاعلانات وكذا، تقرا التايتل كذا حتى يجيك انطباع انه في شيء ثاني، تدخل تقرا في هذا تلاقيه انه totally things. Don't do this in research. ما حد no one will cite you. طبعا انتوا تعرف انه what is the like button في research؟ like button انه people will cite your work. If they read the title about something and then they go into the manuscript and they find something wrong or something not answering the question, no one will cite your paper. طبعا هذا if the editor agreed about your publication with this title. So always you have to be scientifically correct, and always spend sometimes to spend more time to select the title. The title is really very important. The title is, I would say, is the most important factor for the citation. Number of citations. People would cite your work. طبعا there are many factors like the quality of the work, what is the topic, but the title is really, it is the door to your paper.
Okay, thank you, doctor. The second question, if my data analysis result showed something odd or something strange than my primary objective, it's not objectively clear that there's something in the data, but I suspect something. May I add it in the limitation or for future research or skip? Yeah.
No, so first of all, it's not limitation. This is number one. Number two, the one who can tell you what is the explanation for this is the expert in the field. Like, for example, in neurology, it's the neurology consultant. If you're doing research in immunology, it should be an immunologist. believe it or not, all the discoveries, it come by chance. So you shouldn't ignore it. So you have to double check it, verify it, make sure it is true, and you have to put a justification. You have to put a justification. Even if you don't have anything, you have to let search from the literature. Even if you don't find anything from the literature, you have to put a justification. Justification of what do you think is the most likely cause for this finding. So it's very important. Sometimes it can be a positive thing about the study. So it's not a limitation.
Even doctor, if it raises a new ideas or a new objective apart from my primary objective.
طبعا
ممكن لما
it is
يقرأوا
بالعكس
البيبر
it is
يحسوا
good.
إنه فيه
بس
أكتر من
make sure if it is really very unique, you don't tell it to anyone. You don't publish it unless you يعني prepare starting for the next project. For example, I'm doing like a project about something, and then I found something that is giving you an advantage to the next step. Okay, start the next step, prepare, be ready before you publish your research, or يعني finish يعني go to the second step وبعدين then publish. طبعا most خليني let me be clear and transparent about this. Most of these things happen when you're already established in the field. Like if you're for example, you're a resident, even not a resident, when you are already a consultant, then you can do this kind of research. But as a student, as a resident, you need to get your work published early. So it depends on the level, it depends on the scope, it depends on the findings, and sometimes some findings has no meaning, some findings, sometimes it's already known in the literature, sometimes. So it is really dependent on the finding and the mentor. You have to ask your mentor specifically. We found this. What do you think? Also, there are some mentor who are some like consultant can guide you if you have like findings, but don't ask someone that you don't trust. Make sure that you ask someone you trust. Come and he will give you advice if it's a novel finding or it's not novel, or what you can do about it.
Okay, thank you doctor.
Doctor, there's a question in the chat box. Someone published his first article in a predatory journal. He learned more on research and knew about predatory journals later on and published his new articles in good journals that are not predatory. Should he put the first research published in the predatory journal in his CV when applying for residency and explain to the committee that he did not know that at first, or no need to put it at all? Thanks and sorry for the long question.
No, that's really an excellent question. In the CV, you put what you think it's representative about yourself. And if you put something, يعني if you put if you don't put إنه you publish this paper, that's okay. It is completely up to you. Why? It's not mandatory to put everything about you. أنا كمان مثلا أشتغل في أوبر، امزح يعني مثلا ما لهم صلاح. مثلا انا مثلا شغال مثلا في البورصه وفي الاسهم. It has nothing to do with the job I'm applying. ف why I put, so you decide what you think is important to put it or not. Sometimes for example I'm applying for a job for example neurology program, and I did research for example about surgery or about ophthalmology, but I have other publication. I don't want to put this publication. You can take it out. So it doesn't consider, it's not considered lie. So you're not lying. You're not. So you put in the CV what you think is representative of yourself. Why you waste the time of the interview talking about a mistake that you did before? There is no point of it. واحد يعني مثلا did a mistake before, for example, as a medical student you did a mistake like misconduct or you did anything. خلاص عفى الله عما سلف. انت يعني استغفر وتوب لربك، هذا بينك وبين ربك. if he knew, if واحد من الكوميتي he knows about this and he bring it up، خلاص then justified انه this is a mistake I did. Being honest, don't lie. You know, if you have a weakness in your research, say it. Don't lie, like, and say it in a way does not affect the position of the paper. Don't hide it. خلاص. في الببليكيشن if it's related to research. في السي في ما انت ملزم انك تحط كل شيء. يعني انت كنت ماشي بالسياره وبالغلط دعست واحد ودخل العنايه مركزه، خلاص يعني استغفر ربك، توب، روح اتصدق، ساعد هذاك اللي دعسته بالسياره. مو لازم تحط في السي في حقه والله انا دعست واحد بالسياره. لا خلاص. وصلت لكم الفكره ولا قاعد؟
Yes, thank you so much, Doctor. Lamar, your question?
Doctor, we see a lot of research papers that its main objective is to look at the clinical features and prognosis of already known disease. So, are those paper really worth publishing? Because we already know the clinical features and the prognosis of those diseases. Why do we get through all of this and repeat it again?
Sometimes it is not known in our region. Maybe if it's done in our region and in the same hospital, there is no point of doing it. But if there is a point of doing it in a different way or in a unique way, you can sometimes you can do just minimal twist and you make it unique, although it is the same thing. I give you an example. Like, for example, characteristic and clinical features of patients with Friedreich ataxia. We have this manuscript. We will submit it to publication soon. But then I'm doing the same thing, but different. I'm now describing their electrophysiological finding, or I'm describing their response to the treatment. So if there is a new findings, then it's okay. And this you should decide before doing the research. ما هو بعد ما تسوي الريسيرش وبعدين تقول اوه والله دي هذا. And who's gonna tell you if this is worth doing or not worth doing? It's your mentor. Or you can ask. يعني I'm more than happy to help anyone doing any research in neurology. Is this يعني someone can ask me. صباح الحين I don't sometimes I'm not necessarily يعني directly mentoring some student or some resident, but I can give you my advice. والله احنا سوينا كذا 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 كذا, we're stuck at this. Should we continue? Should we do this? Should we do that? And I can give them an advice.
Doctor, what if it's يعني the main difference between the study I'm going to do, both the clinical features and things I said, the main difference between it and the other published papers is the demographic area. يعني mine will be in Saudi Arabia, but theirs is in Canada. Is this enough difference?
Yeah, it is important. Yeah, it is important. It's not actually it's enough. No, it's very important. If there is no cohort published in Saudi Arabia, that is important. What about someone is like, for example, someone did a study in Western region, and you want to do it in Central region or in Eastern region? Is it still worth it? Yes, still. And it's still you might conquer or compare your data with the other one. It will be a nice paper. طبعا again, who can tell you about this is your mentor. It all depends. You know, always when I start with any student, I ask them how much time you have, what's your objective, over how long you want to finish this project.
Asil?
Doctor, I have a question. What if my research that's about my interest was published in Q1 and high impact journal, but it's not my interest anymore? Should I put it in the CV or not?
ممكن تعيد السؤال؟ ما فهمت قصدك. يعني انت الريسيرش الببليكيشن عندك in Q1.
مثلا ايوه، لو كان عندي publication I'm interested in neurology و I have publication in genetics field. It's Q1 with high impact factor.
لا Q1 دقيقة. Q1 حتى لو is not your area, so it is a strength. عندي Q1 paper في electricity ولا in economy ولا حتى حاجة non medical field, it is something very strength because not everyone can publish in Q1. انت ما شاء الله عندك Q1.
Yeah, I have 3 in Q1.
خلاص خلاص ما شاء الله خلاص put it in your CV. لا you don't take it out. Q1 غير. بس طبعا always they will ask you انه how did you do it, what was your role. طبعا احنا there is something else هذا في الانترفيو, and we know if someone what is his contribution in the research. يعني we know very يعني easily, يعني just a simple question يعني على الستدي ولا what was. So any research you put in your CV you should know it from A to Z. And you should answer what was your role, what did you learn about it, how it was conducted, everything.
Okay, I believe there isn't any more questions. Thank you everyone for joining us today, and a special thank you to Dr. Ahmed Abu Laban for a wonderful session. يعطيك ألف عافية دكتور, and thank you everyone.
يعطيكم العافية وبالتوفيق إن شاء الله. So I gave you lifelong maintenance about what I said. So if anything you forgot from this lecture or you have any other questions, please reach out and we'll help you and support you. Okay? يعطيكم العافية.